Hello everyone, welcome back. Today let's talk a bit about GP training in the UK. Trying to understand the GP training structure when you first arrive feels like stepping directly into a maze. You will hear medical abbreviations that you are not familiar with, and honestly, it's enough to make your head spin. But here is the ultimate secret. Once you understand the foundations, the actual journey becomes less stressful. The fear doesn't come from work itself. Fear comes from not knowing what to do. So today, let us map out the maze together, step by step. In the United Kingdom, the standard GP training is a 3-year marathon. But it is not just 3 years sitting in a quiet consulting room. You're going to spend 18 months of that time working inside a hospital post in various clinical settings. And the other 18 months, you'll be working as a registrar inside the GP surgery, working closely with your educational supervisor. Over the 3 years, you are required to demonstrate your learning and build competency in your 14-fiche portfolio. This portfolio is where you log your clinical consultations, your feedback from patients and colleagues, and any academic achievement. It is essentially a living document that proves to the regulatory bodies that you are doing your job and developing your skills to become a qualified GP. So right from your very first week, you are actively being assessed. This means that you cannot afford to leave it until the end of the year. Your progress will then be reviewed by a panel of GPs who decide whether you are to progress to the next year of training, or in your final year, they decide whether you are competent to be awarded your certificate and practice as an independent qualified GP. I want you to hear this loud and clear. The vast majority of foreign doctors who struggle or face extensions are not bad clinical doctors. They simply do not understand what assessments are actually looking for, or they didn't know how to properly demonstrate their learning to meet the expectations of the training program. I absolutely refuse to let that happen to you. I want you to be the doctor who sails through with flying colors. To ensure that, I am providing you with a specialized guide outlining the expectations for your first review. We will cover this in depth in the induction program, so make sure that you attend all the sessions. We will show you real examples and give you practical advice that you can use from day one of your training. So download the guide, get comfortable with it, and I'll see you very soon in the next video.